Assalamu alaikum. Hello everyone. Good afternoon. Assalamu alaikum. Welcome to this distinguished seminar, international webinar about the neurophotobiomodulation, or actually application of neuroscience and photobiomodulation in the neuroscience. Let me check something is wrong. Actually, this is my great pleasure to welcome all of you to this seminar, special international webinar. And I'm honored and excited to be here as an organizer of this webinar. And I'm really excited to this interesting participant as a distinguished group of neuroscientists, psychiatrists, and the neuropsychologists and neuroresearchers around of the world that together today. And my name is Maryam Noorbakhsh. I got a PhD in physics, and over the past years, over 20 decades past years, I've dedicated my research to the design and development some medical devices, and also especially in the field of neuroscience. And recently, I focusing on developing some laser therapy devices, and especially in the field of transcranial photobiomodulation. It's the topic of the webinar of today's webinar. And as you know, today's webinar brings us together to explore and discuss about an innovative and actually non-pharmacological approach to managing and controlling some brain disorders, some neurodegenerative disorders, and actually brain disorders. This approach is known called transcranial photobiomodulation, that we try to talk about this topic today. But just before going to the my main talk, let me give feedback from all of you. Can you hear me correctly? Can you?
Yes, Dr. Maryam, everything is perfect. Thank you.
We can hear you correctly now.
Yes,
we can
please
hear you
share.
now.
Thank you very much. And what about the screen?
Please change the format of PowerPoint to full screen, please.
Okay, full screen. No. Before going to start my talk, let me introduce you to these sessions. Actually, these sessions include 4. In the opening talk, that it's mine, I'll give you a brief history of what is the laser and what is the low-level laser therapy and the historical approach of the photobiomodulation. And after that, I will go to especially the application of the neuroscience, and introduce you some technologies related to this field. After me, some distinguished speakers started the talk, and the cellular and the molecular mechanism of laser, and also will give you some practical research evidence or clinical evidence by using neurophotobiomodulation to treatment of some brain disorders. Okay, let's start my talk. Lack of time, and we hope to have a full session today. And the topic, the main topic of today about laser, and before going to that, the talk about what is laser and how does it work and how it's going to the medicine and how founded modulation. Let's discuss challenges in the treatment of disorders. The first challenges is the lack of curative treatment for many disorders. As you know, many psychiatric disorders or neurodegenerative disorders are completely curable. And another is we know that many significant side effects related to psychiatric medication. As despite medical advances, many decades research science, we know that many psychiatric and neuro diseases, for example, dementia, Alzheimer, or Parkinson, or maybe trauma and other psychiatric disorders, still have not cured. And just treatment focusing on actually managing some symptoms and trying decreasing some symptoms rather than a true recovery. And as we know, diseases increasing rapidly in all of the world, both in terms of the absolute number of people that can affected by these diseases, and also the burden of diseases in the case. So, an uncertain side effect of psychiatric medication, so that for medication that today is using for treatment or psychiatric disorders, actually come with a wide range of side effects. For example, we can tell you about, for example, this side effects, for example, dry mouth, headaches, or maybe eye pain, blurred sleep disturbance, or maybe some stomach pain or upset, constipation. Maybe you can, your patient maybe weight loss or gain loss, or even some cardiovascular problem that's related to this. It's common side effects of these psychiatric drugs. So maybe we think about that. We think about maybe some new technology could help solve these problems, and we think about actually this is a reasonable thought about that some new technologies or some neuromodulation technologies might overcome what these two challenges. As we know, many of these tools actually come with their own challenges, and often don't deliver the that we hope for. For example, several emerging neuromodulation technologies, such as transcranial magnetic stimulation, for example, TMS, or deep brain stimulation, DBS, as we have shown promise, they are often invasive, expensive, or limited in accessibility, and of course, long-term efficacy. And actually, the patient, their problem actually relapse after some months by using this kind of technology. It means that the existence technology actually cannot overcome these two challenges. And so the important question is what is an innovative and non-drug solution? And today we are trying to talk about the role of laser or light therapy, that shining light actually to maybe we are hopeful about making we can overcome to these challenges. So before going to the topic of the laser and how it's going to the therapy, let me give you a brief history of the light therapy that is back to the maybe 1,000 years ago, to ancient country, for example, India or China, using sunlight for therapeutic purpose, as you have seen this picture. And also after that, actually this century, using sunlight to actually therapy more famous. Cure the cancerous growth on the lip using a sun bath by and all through the lens and accelerated healing by these kind of techniques, and actually in the sunlight. And also they are using created some kind of RCTs that the bacterial infection. Slide down. Excuse me, could you see my slide? PowerPoint is, you can see everything is okay? You can
yes,
see.
but it doesn't.
Not changing the slide. It's just one spot seen. So I think you should change the slide so that we can. All right.
Some people tell me that the slide is not good, but It's okay. Okay, let me.
Can you make it full screen?
Now it's good. You can see it. You can watch this page. Okay.
Can you make your slides on full screen?
Now it's full.
ریدش کنید اون پایین صفحه.
Sure. Just. I think it's full screen, but
آها.
now it's good.
Let me check again.
Slides have gone now.
You have removed it entirely now. We are not seeing it again.
Well, let me just a moment. It's full screen now.
No.
No. If I full screen, I cannot show it. Maybe I can.
PDFش کنید.
It's
You
just,
can change to PDF format, please again.
Is it on PowerPoint?
sorry for this technical problem.
It's okay. Yes. Now it's
How is it?
it is showing.
Okay now?
It's
Yes.
okay.
Okay, thank you. Sorry for this
Okay,
technical
Oh,
problem.
it's okay. It's okay. That's okay.
Prof, it's okay.
Thank you. Oh, no. As I told, that some interesting pay attention to using sunlight to treatment some diseases, for example. And in this century, that I mean, the therapeutic application of sunlight, homeopathy gradually become popular and vital in the around of the mountain, and the sunlight is to prevention of rickets by modulating vitamin D by scientists actually interesting. That you know that creating the red light, and after that by creating the lupus, but by using blue light, and actually he achieved the name of father of laser thing. And actually successful to get to achieve Nobel Prize. Oh, I think I cannot change the. I cannot change the. Now let me give you about a brief story about what is laser, and some specific parameter of the what is laser, and they give you a brief story about the laser, about the scientific and medicine. And you know that the laser is a kind of light. Actually, it stands for, you know, that the abbreviation of a light amplification by stimulated emission of radiation. That you know that is some kind of technology that's actually discovery, but after that Einstein introduced the theory of stimulated emission, and after established of the quantum mechanics and some discovery about related to the concept of the particle and particle concept of the light that called photon. And after that, you know that the first laser discovery, or actually made by Theodor Neumann, the first operational laser that built by some kind of ruby, that he can achieve the Nobel Prize at 1964. And after that, development of some different type of laser by some, for example, gas laser, the helium neon, or CO2 laser, or NDI laser, or some kind of semiconductor laser discovery. And you know that the first laser when made, made by some power of laser that is a very high power laser, for example, 10 power or 2 power or more than 1 power, 1 watt, I mean power, that nowadays we called it this high power. But after, by discovery of the lasers, they are, after, for example, 1 or 2 years, they are coming to the medicine. And the laser used for example, cutting or ablation, and also because of the, we can use the high power laser as some kind of knife. I mean that it's the good kind of cases for using bloodless surgery, or because of by this kind of high power laser, there is no coagulation, and it can be used for application, for example, bloodless surgery, more ablation, or some kind of eye surgery, and they are familiar about this kind of application. And also for dermatology, it can be used, and cosmetic. And for neurosurgery or precise tumor removal, you can use the high power laser. This kind of laser focus on thermal and destructive effect, not cellular stimulation. But when we are using a laser high power, we are dealing with approach and destructive approach of this kind of laser. But let me give you a short story, and we don't have enough time. That it's a story, discovery of the application or the biostimulation of low power. It's back to the Andrew Master. Andrew Master was a surgeon. He tried to using some kind of the laser operate some kind of cellular tumor that he tried to actually attach to the some. As you have seen, the left rat the surgery tried to expose some kind of laser, and the left rat giving the laser beam, but the right rat, it's after some sessions, he find they're not destroyed. Actually, that in the laser treated animals, I mean that as you have seen, the skin actually the wound of this skin is healing, and actually moreover the growth, the hair applied on the rat skin growing to be. This is the Andrew Master trying to solve. He actually understood that the custom designed ruby laser that he was ordered, it watt laser, but after examining the laser, it was just on milliwatt laser. A laser in the low power, we are dealing with some kind of new approach. Instead of thermal approach or actually destructive effect, we are find some biostimulation results. This observation actually goes to enhancing wound healing and healing in mice, as you have seen, and growing some application of this kind of laser. The discovery of low-level laser therapy by Andrew Master leads to call him to the father of photobiomodulation. As I will explain about this topic, that after discovery of application of the low-level laser therapy in medicine, it switched this form of distraction to a stimulation of biological tissue. I mean that low-level laser therapy is a kind of stimulation of biological tissue. And research on low-level laser therapy actually observed the effect more attention about and very interesting. And nowadays, you can find many papers published on laser biostimulation in medicine. And this topic has a terminology that we can call this topic low-level laser therapy. At the first discovery of this technique, it calls low-level laser therapy or low-level laser irradiation or non-thermal laser or low-level laser. And also because it's very cold, I mean, there is no thermal effect after using this kind of laser. We called it cold laser or soft laser. And also laser therapy, because instead of high power laser that can destroy the tissue, now we are dealing with some kind of healing or some kind of therapy just by using laser. And nowadays, we call it photobiomodulation. This term is popular. Any question? Let's start.
No, thank you.
Okay. Now let me give you some laser characteristic that it's better to know to go to the application of this kind of laser in the medicine. You know that laser is the different. We can classify laser and the normal light by three characteristics. The important specification of laser is that laser is monochromatic. I mean that a single color wavelength. For example, when you see white light, you know that when one white light absorbed by some kind of insight or optic, it can gives you some color, different color, for example, rainbow colors from the violet, blue, green, red, and etc. But if you emit or irradiate some kind of the laser color on the laser, you can find green laser, no another color. It means that every laser just had one color. But for example, you know that when we talk about a green color, it means that, for example, 115 up to 132 color, it means, for example, it's a spectrum of the red color there are. But when we are talking about a laser beam, I mean that when we are talking about, for example, red light laser, we are emphasized that what is the wavelength? I mean, we should emphasize about the wavelength exactly. For example, it's 650 nanometers. Not it's a laser. And characteristic of laser is it's non-divergent. As you know that white light or normal light is this actually can divergence everywhere as a spherical space. But laser light is a divergent direction just by in one beam, and you can find as you have seen in this picture. And another specific of laser is its coherency. You know that the laser as a kind of wavelength, and we are talking about classify laser by some characteristic. at the first, we can classify by its wavelength, for example, the color of laser. I mean, and as you know, we can maybe category of this green, yellow, and up to, and we can find and we can build some infrared laser is that 700 to up to 1000 nanometers, and also mid-infrared laser. A category of the laser is that you have seen that high power laser that can be used for surgery. It's the high power laser classified medium power is the less than 50 minutes. So as a result, power laser, it's a kind of invasive approach. It gives you a hit more removal, and however, it's a fast effective but a short lasting, and using the high power laser is usually painful and come with side effects. However, when you are working with a low healing and therapy, and we can use it in neurotherapy, pain relief, bone healing, physical therapy, and also in neuroscience or brain disorder. And it's, however, using the low power laser is somehow the result is somehow lower, but as I told, this techniques, I mean that the low-level laser therapy is a we called it modulation. Photo goes to the names of bio, I mean that a living cell, and modulation is some kind of influence, exert influence, some kind of the regulation. And this technique describes some their response to the light. And actually, the next speaker, Dr. Maryam, will explain photobiomodulation. I mean, that the cellular level perfectly. And but just let me just briefly tell you about that. You know that every cell has some mitochondria, and mitochondria has some. There is some photoreceptor that can achieve the light, and after this absorption, some photochemical reaction can happen, and the outcome can be, for example, increasing the adenosine triphosphate, or regulating the amount of nitric oxide, ROS, the reactive oxygen species. For example, it's a primary effect, and after that it's going to the secondary proteins and transcription of gene, and it could be to neurogenesis and the angiogenesis, and also synaptogenesis and other outcome that we'll explain more. And when we are using this head, it's we call it photobiomodulation disorders. Usually we call it transbiomodulation. And as I told you, biomodulation involves shining high or infrared, usually using red or this the kind of the wavelength is better, and we can use it on the head. Can penetrate through the scalp and into the brain, and some specific chromophores or photoreceptors, and it can do some organic, molecular, and cellular reaction happens as some primary effect, and after the secondary effect and emergent effect can happen. Mostly the result that we have seen after using photobiomodulation on the scalp is, for example, we have seen the more angiogenesis, more vasodilation, and also more blood flow, maybe cerebral oxygenation, maybe increasing the inflammation, also increasing anti-inflammation, and also another point is increasing the brain-derived neurotrophic factor that can that it has shown specifically in the literature. So this technique can be used for a therapeutic application, different kind of disorders. For example, traumatic event, for example, a stroke, TBI, or global ischemia, for degenerative diseases, dementia, Alzheimer, Parkinson, or MS, a psychiatric disorder like depression, anxiety, autism, PTSD, OCD, or learning disorder, addiction, and etc., ADHD. Also, it can be used for cognitive enhancement in normal, healthy people. There are a lot of papers that study these disorders, and in the animal study and also clinical study, they have shown that we can use this kind of technique. And you might ask about why we use 100. What's the better? What's the best actually wavelength for penetration on the scalp? In this picture, you have seen some stimulation, Monte-Carlo stimulation on the scalp that shining 3 different wavelengths, 660 nanometers. It's a kind of red laser. 800 nanometers. It's an infrared laser, and another infrared laser, 980 nanometers. As you have seen, the 810 nanometers, it's ideal for brain transcranial biomodulation. Actually, it has more penetration. It can penetrate the scalp and the scalp effectively, and also because it's this wavelength, it's matched by some the peak of the cytochrome C oxidase. It's a mitochondria target. That is a kind of absorption. It's a photoreceptor in the mitochondria, and it can boost the cellular energy, I mean the ATP, and this wavelength supported by a strong clinical and preclinical evidence. And also it's very safe for repeated use in cognitive and brain disorders. Because I think it's we don't have enough time, and my slide is very, I think it's better to switch to now. It's better to stop my talk and go into the next speaker. But if you wish, I can proceed just 10 minutes. What do you think, Dr. Maryam? Photino brain laser therapy device. Just let me show you just a little bit, just maybe 2 or 3 minutes about this device, that how does it work. This is kind of the devices, but using that made in by Insightsprism company. It's located in Iran, Tehran, and just can you see the slides correctly?
Yes, we can see.
Yeah. As you have seen this picture, you can see this device has a unit control, and also it has 8 laser probes. Each laser probe has have the 810 nanometer wavelength. I mean the infrared wavelength. As you have heard from all speakers, that this wavelength is very good penetration, and recommended from the many literature that this wavelength is very good for PBM in the brain disorders. And this device enjoy a silicon cap that designed by a Stan 1020 system. As you know, it's the EEG compatible system that you can set each probe based on the your desired protocol. That it's depend on the actually diseases of your patient. For example, maybe for depression, you use the, for example, FP1 and FP2 or F3 and F4. But for example, for some another disorders, for example, for Parkinson, you can use CZ or FZ. And it's you can change the position of the each probe, and also you can switch off or on two probes, two laser probes or more. For example, 4 laser probes or 6 laser probes or full of laser probes. I mean 8 probes. You can montage or set the whole places the scalp of your patient, and after that you can set the power and frequency of laser by changing the parameter in the unit. In this device, you can actually set the frequency of pulse. For example, is this frequency compatible with the EEG frequency band? I mean that from the theta wave or delta wave up to high gamma wave. I mean, you access to, for example, 3 hertz, 4 hertz, 5 hertz, and also 10 hertz, etc., up to 100 hertz that you can set, depends on your patient. And also this device, we can, because you can change the number of active probes, and also you can change the dose of energy. I mean, you can change the power of delivery that you want to deliver. I mean, the power of each laser that you want to deliver to the patient. And also you can set the time duration, and at the end, the dose of energy that it's called expressed by the joule per centimeter square. And you know that the joule parameter is very important when you are dealing with the photobiomodulation therapy. And this device is very good suggestion to initiate any actually study project, clinical or preclinical project, if you wish, because there are a lot of parameters that you can set based on your project. There are many evidence that a large number of clinics in Iran and nowadays using this device for project study. And because of the lack of time, I ignored them. And after that, I will share you this PDF in the groups. And just I will show you the animal model of these devices, that you know that you can start many animal research on the rodent or mammal research. But for rodent, because you know that the rat is very low weight, and you have to use a very small and tiny probe. And because of this, a company actually initiated and made a special probe for this kind of study project by different wavelength. A large wide of wavelength is accessible. So now, just thank you again for your contribution and attention for this talk. And again, thank you again for all the speakers that come together and accepted my invitation. And thank you, all of you, to come here and this good discussion. If there are any question, we can ask. Just let me invite all of you, if you have run any new project in your institute or university in around of the world. As you have seen, many participants from different countries, Pakistan, especially India, Nigeria, Indonesia, Malaysia, and other countries come together here, and this is very interesting for us. And if you want to initiate a new project with us, our group, with our institute, and also with Dr. Mehrabi in Iran Medical University of Iran, you are welcoming. It's a very good news for us. Thank you for all of you. Thank you very much. If there is no question, we can finish this session. And we hope to see all of you for another session. And as you know, the photobiomodulation is a very, actually, very big topic, and it needs more sessions, maybe whole days, and maybe a full school to more discussion about this topic. And just this webinar, we wanted to give you a sense or just give you a hint about you can use this kind of non-pharmacological approach for maybe the treatment of brain disorders and maybe initiate some new project study. Thank you again. I do appreciate it for all of you.
Thank you so much, Dr. Maryam. It's really amazing and it's very informative topic. Thank you so much.
Thank you, all of you. Thank you for your coming.
Thank you, Dr. Noorbakhsh. Thank you very much.
Thank you, Dr. Fikrazat, for your coming and very good discussion. I'm very glad to my old friends, Dr. Zahra Batul here also, and some of my Pakistani friends in the ICCBS University in Karachi University.
Yes, absolutely. We met there in ICCBS, and that's why we joined here.
Yeah.
Right post-COVID, pre-COVID time, and that was really amazing experience with you people.
Sure. It's a very interesting time, so for me it was. So thank you very much. Let me finish this session, and Khuda Hafiz, goodbye.
Khuda Hafiz, Allah Hafiz.
Khuda Hafiz.
Wa alaikum assalam.